So, what do you do if your drain gets stuck and you can't get it out? Now, I just have to start by saying that you should never, ever, ever remove a drain unless your surgeon specifically tells you you can do so. And if it is not coming out easy, you should just stop immediately. So, once the drain is giving you trouble, unfortunately, this is really something that your surgeon needs to handle. This is not something that you can do at home. So, there's a few things about drains that are important to understand. So, the first thing is there's different types of drains. There's drains that are the same size the whole way, and there's drains that have a hub. So, drains that have a hub, there's a bigger portion right inside the skin. So, they actually take a little bit of force to remove. And just to make things even more confusing, there's a drain called a pigtail that's like a curlicue. And those are taken out in a totally different way. Now, plastic surgeons, we don't typically put those in. Sometimes IR doctors, interventional radiology doctors, will put those in for us if you have a seroma. So it's really, really, really important if you're taking a drain out that you know exactly the type of drain you're removing. In general, surgeons are not going to have a patient remove drain that's going to be a difficult to remove one, hopefully. The other thing to consider about drains is how they're sewn in. So we all have our different techniques. Sometimes we sew them in with just one suture, sometimes we sew them in with multiple. So it's really important that you know exactly what to cut to get the drain to come out. And you want to cut it in the right way so you don't leave any suture material under the skin, because that can be irritating and cause trouble moving forward. Okay, so say you have an easy to remove drain and you go to remove it and it's hard to remove. So there's one of two things going on. The drain has been in for a while and some scar tissue has formed around it and it's, twirled around inside in a way where it's not easily coming out. Or a worse problem is that your surgeon accidentally sewed it in. So while they were closing the skin, a stitch accidentally went through the drain, not intentional, and you're not going to be able to remove it because it's stuck in there. So say you think it's scar tissue. The first thing is that I, as the surgeon, take over. This is not something I would ever want a staff member or a patient to do because I know the size of the drain that I put in. And if I'm going to go yanking on something, it could potentially break. And I need to look at it and make sure that the whole thing came out. We cut these things in the operating room, so they look different, and every surgeon will know how long they usually leave drains. So it's very important your surgeon does this, or at least is there to examine the drain. So when I pull the drain out this way, you'll have nothing happen. The drain feels like it's stretching a little bit and then it will give. And it's just something that you learn with time, how much you can pull where is safe and how much is so hard that the drain is going to break. And it's very important, like I said, to examine the drain when it comes out and make sure the whole stinking thing is there and no pieces were left behind. Now, if you have kind of the worst problem, which is there's a stitch going through it, you're not going to get it out unless you go in and release that stitch. So your surgeon, of course, needs to be there for this thing too. And you gently pull on the drain until you see a puckering. You can usually figure out kind of where the stitch is going through it and just open up the incision in that tiny location and cut whatever the offending stitch is, remove the drain, and then sew up that little area. So this can be done in the office. We use local numbing medicine for most patients and most problems. Totally annoying problem, but it does occasionally happen. Now, if you are pulling a drain and you're either inexperienced or did not recognize what was going on, or the drain became weak for some reason and it breaks, then you got to go back to the operating room and remove it. You can't leave it behind. So it's certainly a problem when drains get stuck. The most important thing is that you stop. If you, as a patient, were instructed to remove a drain and it's not coming out easy, abort mission and call your surgeon. And if, like you, your surgeon is far away, they hopefully will be able to help you find someone near you, or you're going to have to go back.